We are pleased to welcome Dr. Laura Bellows and PhD candidate Shariba Oak. Dr. Bellows is an associate professor in the Division of Nutritional Sciences. Her research is focused on the development of eating habits and physical activity patterns in early childhood, interventions in the early child care setting, and the influences of parental behaviors and the home environment on the development of these behaviors. Much of her work is focused on health disparate populations, including those with limited resources, who are Hispanic or Latino, and who live in rural communities. As an interventionist, Dr. Bellows is interested in the optimization of intervention design, as well as health and digital strategies. Dr. Bellows has been awarded the Presidential Early Career Award for Scientists and Engineers, or PCASE, by President Barack Obama in 2011. Ms. Oak is a third-year PhD candidate in the Health Behaviors Lab chaired by Dr. Bellows. She earned her master's in biomedical visualization from the University of Illinois, Chicago, where she was trained in visual design and communication. Her master's thesis work involved the development of a mobile application for patients with obesity, and currently she is working on designing and developing a mobile parenting app for parents of preschoolers focused on nutrition and physical activity behaviors. She hopes to make an impact on health behaviors in various populations by exploring the interplay between digital platform design approaches, behavioral science, and implementation science. Please give a warm welcome to Dr. Bellows and Shariba Oak.
Thank you all for being here. I know we're also competing against the tip for the NCAA basketball tournament. So I know you had choices today. So to get everyone going, we started this question of when you hear the term digital intervention strategies, what comes to mind? So just hit present. Let's see what everyone said just to get us, and hit responses. Maybe. All right. So we've got accessible, mobile app, online, behavior, social change, impersonal, outreach, interventions, reminders, phone, eating, telehealth, technology. So lots of different terms that come to mind. So we're going to talk a bit about digital strategies and how we're using them and how we're designing them and how we're engaging different audiences. So now we're good with the Does this work? Awesome. Yep. Okay. So as I mentioned, we're going to talk about digital health strategies and the work that we're doing in our lab. Maybe, oh, there we go. So we answered that. Here's the terms that typically come up if you look in the literature, or for those of us that are doing digital interventions: e-health or electronic health, m-health, meaning mobile health, web-based software, mobile apps, telehealth, telemedicine. We're seeing more and more of that, especially with COVID, how we started to be in touch with our physicians and nurses. Games for health is a way to try to engage in a fun and exciting way. Smartphones, wearables, so sensors. We're seeing a lot of biomedical engineering working on sensors and wearables, smartwatches. Many of us in this room have an Apple Watch or something of the like. And then AI and machine learning. I think we're starting to see more and more of that come into play, even in our own teaching here. So we're going to focus primarily on m-health or mobile health and our app development that we've been doing in the work in our lab. And so the roadmap for today, I'm going to talk about m-health, get everyone oriented, and then talk about the user experience and how we incorporate that in development. We'll walk through an approach of our first set of apps that we did with children in our healthy environment study, which we refer to as HEROES. And then Shariba will come in and talk about user-centered design and the work we're currently doing in taking our traditional HEROES intervention and turning it into a digital intervention with eHeroes, and then pull it together of how it relates to translational research and intervention design. So why m-health? And sometimes we hear, well, why are we going to be on our screens more? What are we doing with it? And I saw the word impersonable that came up in the cloud, which can, for some audiences, it will seem impersonable. But for others, it may be that it makes it more accessible. And if we think about people who are working shifts and they can't come to a workshop from 6 to 7:30 at night, they have competing demands. For those that live in rural communities, we are able to enhance our reach. So that flexible timing is really key. It can help with overcoming traditional logistical barriers that we see with interventions, such as transportation, childcare, and those work schedules. It can be efficient. There's costs on the front end for development, but it can be efficient to scale it up and optimize it out into different communities. It can be personalized, and personalized in the sense of having branching logic, but also in the intervention study design, such as a smart design, which allows you, depending on how people are responding to the intervention, you can change their condition or the treatment that they receive. The literature will suggest for some behaviors, digital interventions can be more effective or at least replicate the outcomes of a traditional intervention, and scalable, right? So when we think from an implementation perspective, we're always thinking about how our interventions might be scalable so we can potentially, with digital interventions, enhance reach and uptake as well. So this is a timeline. For some of us in the room, we can recognize some of the things that maybe we've done, maybe not all the way back here in the 50s and 60s, but early on it was about physical activity. So pedometers and accelerometers. It doesn't work on these screens. It does. No. So when we get into the 80s, we're talking telephone counseling, ecological momentary assessments. We get into telemedicine or quit lines, so the national quit line, web-based chat rooms, and then as we get further along, we're to get into texting and mobile apps as far. So another visual is to think about the devices in which we get health information on. I know I had cell phones that look like this back here. And then when they were actually just phones and you didn't keep them on all the time, to now having a mini computer, right? So our digital devices are changing along the way. And it's important to note that the technology, as it changes, and it's changing very rapidly, the device is the tool, right? But it is not the driver of the intervention. And with that, we need to ensure that we're still staying true to our intervention strategies, such as behavior change techniques, and using the digital devices as the tool for implementation. So there is a sea of apps that are out there. And so I just want to touch on the current landscape related to mobile apps, particularly as they relate to health. So these are the number of mobile downloads that are from 2019 and then projected out to 2027. Clearly, there's one that's gaming that is higher than everything else. Health is buried in the middle down here. And health and fitness apps are 4.2 billion downloads a year in 2023. So it certainly has a big impact with a lot of people who are downloading them. So there are more than 350,000 health apps, and there were 90,000 that were added in 2020. That number continues to grow, and we all know what was going on in 2020, where gyms got closed and we transitioned to doing our exercise and fitness online. Clearly, there's a lot of money that is in tech development, with revenue of 209 million just in the fourth quarter of 2020, and then 1.2 billion is being spent on the development. So lots of energy in the economic sector related to apps. Who's using them? Nearly 2/3 of US consumers are health app users. Exercise and fitness apps are the most commonly downloaded, followed by general wellness, meaning nutrition, weight loss, and sleep. 50 to 60% of us use a health app daily, and that's a 6% increase over the last 5 years. So who's using them? They tend to be younger, have higher income, more educated, and tend to have some health conditions or poorer health, such as being obese. Older individuals, so I need to preface this when I was putting this together. this younger older thing, right? So older, I was actually with my 80-year-old dad. And so when I think older, I'm thinking him. And then I looked at the bottom end and realized I now am part of this category. And I it kind of was like taken back of being called older, but so take the older, younger with a grain of salt. 44% have ever used a health app. So it's definitely a little, as we age, less folks are using them. And only 28% use one routinely. Okay. So we have to know when we're developing digital interventions who our audience is, how they're actually using digital applications or digital strategies. This is a graphic out of the University of Michigan, the Institute on Healthy Aging. And what I like, while it's for that 50 to 80-year-old group, the trend of the types of apps stays true depending on age group, where exercise is the most downloaded and used, followed by nutrition, weight loss, and sleep. And then mental health apps are actually the least used with health-related apps. One of the key concerns with mobile app use is the discontinuation, right? It's one thing to download it. It's what else are you going to do with it? So 25% of apps that are downloaded are only used once. And I'm sure if you all looked at your phones right now that you have plenty of apps that you downloaded and probably don't even realize you still have on there. So that is one metric. The other metric is that 74% of us abandon use of those apps after just 10 tries, right? And we don't know if it's because of the app or the behavior and the loss of motivation potentially. Reasons for abandoning are high data entry burden. People just don't want to put in that effort. Loss of interest, and then the hidden costs, right? So it's free to download, and then the more you get into it, they add costs and layer to it. So things we need to consider as we develop. What users want, and this is what as an interventionist we need to be considerate of, is they want flexibility. They want to move around the app in the way that they find they need the information. They want it to be easy, intuitive, and quick. Again, that burden. They want to decrease the cognitive burden they are going to put on it. They want it to be practical and engaging. They want credible information. And this is the piece that we as academic researchers can really play a role in. Most of those 350,000 health apps are from commercial folks, right? And so commercial people can put all the money into it. It's going to have lots of bells and whistles and look at it, but the research or evidence base is missing. And so we as academic researchers maybe don't have all the money and the bells and whistles, but we got the information. So we have to kind of work at blending these with that. But credible information is very highly valued by users. They want it tailored. They want it so that it's tailored to them. If you're going to ask them what their goal is, and then do something with it. Don't just ask them for it and then give them information on a different topic. And provide something of value, the sense of reciprocity. If I'm going to engage in the app, I want to get something out of it. Okay? So when we think of designing, we have to think of this push and pull. And so I'll start with the pull. If an intervention, and in this case an app, is cognitively too difficult, you're asking the participant to pull quite a bit. And we got to balance that with pushes and giving them the information or moving them along the app in a way that makes sense to them and is a lower cognitive load for them to be thinking about. It becomes just more of a natural default. This is a model that is used quite a bit. It's a behavioral model that's been transitioned to technology design. If you look at the bottom, this is the ability to navigate in the app. So is it hard to do or easy to do? And is your motivation low or high? And if the app is easy or the behavior is easy to do and you have high motivation, you're going to be above this green line, which makes the prompting of the app or the intervention, it's going to be successful. If you have low motivation and the app or behavior is really hard to do, you can prompt someone all you want. They're not going to do it, right? So we've got to find the sweet spot of making the behavior or the intervention, in this case, a digital app, easy to use, and then match that with the participant's motivation. Here's another way to think about it. This was a study that was done. It was a qualitative longitudinal study that followed people for 2 weeks using an app of their choice, health app of their choice. And again, the assessment of the app is about functionality, ease of use. If it was high, and then we have motivation, or they define it as persistence of the health goal. If the motivation was high and the ability was high, they continued to use it. If it was the app was high, but their motivation was low, they had limited use, right? Makes sense. If they had really high motivation, but the app wasn't great, they just switched apps. So they were just trying to find a different product that met their need. And if both were low, they abandoned use. So this is how we start to understand users to mobile apps and how we might need to think about and cater to our audiences. So how do we design apps with audience or with the audience and wants and needs in mind? We need to consider what we call the user experience. And the user experience plays a crucial role in the design and development of apps. It focuses on creating a positive and seamless experience for the user while they interact with the app. So this is where we're partnering with our software developers or information designers to make sure that what we're asking the participant to do can be done easily, and that enhances their satisfaction and engagement, and hopefully their retention in using that app. So when we think of the user experience, and we want to be thoughtful here at the UX, there's a user missing in the title, apologies. We want to make sure that the app is valuable, useful, is satisfying, that it's desirable, accessible, credible, and convenient. That's a positive user experience. We also have to match that with the user interface. And that is where that makes it easy to use. So it's the content, the color scheme, the type, kind of the window dressings, right? That make an app really appealing and someone inviting them into using it. So it's a combination of these two factors that we need to consider. So we're gonna walk through two approaches of our own work that we've done, trying to take in the user experience, and then Shriva will talk about user-centered design. The first one, our users were children, and they were preschoolers. So you can just imagine what it's like trying to get information out of 3, 4, and 5-year-olds as we design this, okay? But we partnered with an information designer, which is different than a software developer, and hopefully you'll see the difference as we go through these. So our HEROES study is a USDA-funded study focused. It was a hybrid of traditional face-to-face intervention focused on healthy eating, physical literacy, and mindful parenting of Head Start parents. So lower income, rural communities, and parents of 3 to 5-year-olds. It had parent workshops, child workshops, and then we developed 4 child-centered apps, and each of the families was given an iPad. So in the child workshops, the kids got introduced to the apps. It's a little bit of pester power. They got introduced to it, played with it, and then the parents had the apps on their iPad and were asked to play with those apps at home along with other things. So we worked with New Mexico State in the Learning Games Lab, and it's part of their extension program. So they do a lot of technology, app development, virtual reality, videos, all kinds of tech. So very much information design process with that. What we as researchers brought to the table was we brought the child-centered approach. Again, working with preschoolers, we had to understand they had never worked with children that young. They had upper elementary was the youngest they had come down to. And so we had to consider the development of the child and make sure what we were asking of the child to do is developmentally appropriate. They can't read, right? So it's graphics, it's images, very clear and simple instructions. When you ask an adult what a 3-year-old can do, usually they underestimate what a 3-year-old can do on an iPad, especially nowadays. It's pretty amazing. We needed to make sure we had meaningful content that addressed cognitive, physical, and emotional domains. We still wanted it to be a learning experience, and we still recognize the gatekeepers are adults, right? So we needed to provide that value to them as parents and even childcare providers. Needed it to be interactive so that the child had opportunities for free play, but then they were directed with that. And then parental co-participation. Were we developing something that parents would be willing to co-participate Or were we also giving parents the opportunity to give their child something of value so they could go make dinner or put a load of laundry in and feel okay about their child interacting with the app? So these are our 4 apps that were developed, very child-centered and game-based, and I'll go through and give you a snippet of each of these. The Jungle Gym 1 and 2, very physical activity oriented. Spin and Move was physical activity and nutrition, and then the Tasting Party Express is nutrition related. Each of the 4 apps had a welcome screen, followed by an activity selection. They could choose them or they would be randomized so that the child was never getting the same sequence. And we were hoping that would enhance engagement, that they wouldn't get bored with the same sequence. And then it walked them through a guided activity. Oh, the other thing to note, you can see the red button. For those of you who have had young children in your house, you recognize how annoying toys can be with sounds. And so it's very important for us to have a mute button, right? So there's music in these, but we recognize for parents to want to keep using it, we needed to appeal to the parents. The graphics and images, when we tested, the kids, this is a little avatar that shows the physical activity that we were asking them to do, so that if they didn't understand, this is slide step. So if they didn't understand what a slide step was, this character demonstrated that with them. So I think I'm gonna have to try. So there's no music to this, but this is our jungle gym. Move it up here. It's supposed to. So you can see they're leaping here. And then it walks them through this journey, and there's narration telling the kids what to do. And the frogs are gonna start leaping at some point. Or then the horse gallops, right? So pretty simplistic graphics, but engaging the kids. And it walks through crawling with the hippos. This is the Tasting Party Express. It's gonna load. I went a little, so they could pick which avatars between monsters and people. They pick what food, all they do is drag the food to the plate and they get reactions, some positive, some negative. So our behavioral premise is that kids will reject foods until there's built up familiarity. The monsters burp, they make different silly noises that the kids like, but it also is about building the food vocabulary, such as crispy and sweet and sour with that. I will say that parents think this is incredibly boring to play. The kids, we actually had to take the iPads away from them because they kept doing it, right? So, all right. And then the last is the spin and move. And this is just, they spin it and then they do different activities. So they bend like a banana, they hop through the field with a picnic basket, they move like a monkey, and then they swing a bat at the park to practice those different activities with that. So that gives you a taste of the apps. Oops, I didn't mean to do that. Pause this. Okay. So I just showed you the final product. How did we get there? It was a 2 to 3 year process to get there. We went to New Mexico to Las Cruces and had these group brainstorming sessions, multiple days with the gamers, the graphic people, and then we continue to meet virtually. The products, they provided product proposals that we worked through and scripts that we made sure that it was accurate and behaviorally correct. We pre-tested, they pre-tested with kids in their early childhood center, and we did it the same, and then we piloted and looked at outcome testing. So this is just an example of the product or the product script we got. The Tasting Party Express, our working title is Feed the Creatures, because we started with just monsters. We made sure we were very clear on what our objectives were, what our measures were that we wanted to get out of it, who the characters. So working with preschoolers, they like animation and create the imagination. So we wanted to stick with something fun. They work through all the game mechanics related to when are they going to toggle, when do you drag it, when do we randomize, like that was all the learning games lab. Where we came into play was our evaluation is the dragging of, do they like it? Is it a neutral response or is it dislike? And then what are the vocabulary words we wanted? What are the reactions that we were okay with? What are the foods they're going to drag so that we could reinforce those in our intervention as well? So this was a combination of them working with us, but that they wanted a little more content expertise. And we kind of had to pull them back and be like, that's not where we're going with this, with that. So the outcomes are related. When we were doing the child workshops, we actually projected the app onto the wall and had kids do it. We put accelerometers on the kids because we were obviously interested of what's the impact of these apps. So the Jungle Gym 1 and 2, they take 7 minutes to run through. The good news is we got 85% of moderate vigorous physical activity in that 7-minute time frame, which is actually a lot, especially for this age group. So we compared that. So Spin and Move is S&M, Jungle Gym 1, Jungle Gym 2. And then we compared it as part of the workshop. We did traditional PE. So we had them do an obstacle course, which is OC. And then FMSB is fundamental movement skill building, where we just had them gallop and skip and hop and do all kinds of activities. So you can see that our apps produce the same amount of moderate vigorous physical activity as traditional PE. And so what it says to us is that, I'm a slide too early, that they have an impact behaviorally, right? It becomes a tool, doesn't necessarily become a replacement for physical activity, but it becomes a tool. So then we asked parents, and Lahia Reyes is first author on this paper, what did you think? What's the role of these apps? And so this was a perceived behavioral benefit, strongly agree, 5-point Likert scale of strongly agree on whether the apps were likely to increase the target behavior. So the Jungle Gym, both 1 and 2, 93% of parents thought it would increase physical activity. Spin and Move was slightly lower, not surprising, 77%. And this is where the tasting party expressed, only 63%, because they're like, it's so boring. All they're doing is dragging the food back and forth with that. So that's a little bit of a challenge when you've got such a young age, you can't ask them for feedback. So you go to the parents, but the experience with the app is vastly different. They were going to continue to use high to moderate. We had quite a bit, so that was good. They liked it enough that they wanted to continue to use it. Likely over 80% were likely to recommend it to others. And then the app ratings, depending on which app, ranged basically about 70% of them had a 4 or 5 star. So we were pretty happy and felt like it was acceptable for the audience. It's now looked at on Apple Store and Google Store. It's under the Foods and Moves suite. But our key here is that child-centered apps have an ability to contribute to physical activity outcomes. So in this sample of kids, they were only getting 13 minutes of moderate vigorous physical activity. So for them to play the game just once, they were getting 6 minutes of moderate vigorous physical activity. They did it twice for 14 minutes. They were doubling their moderate vigorous physical activity with that. So lessons learned, that there's a challenge, and I knew this going in working with preschoolers, right? There's only so much information you can get from them, but you also have to understand and take what parents are saying with a grain of salt. You have to understand how they would use it, but also how we might be able to define it. Role definition and working with the information design team. They wanted to just read up on our behaviors and become the content experts. And we were like, we're not comfortable with that. So we inserted ourselves more probably than what they were used to. But we also had very little input on the functionality and the tech side of things. Other considerations that came in more of the back end, these apps live at New Mexico State. So the IP and the copyright are there, even though the content is coming from our group. So that foreshadows a little bit of why we switched directions. And ultimately, the apps were feasible, acceptable, and effective, which is what we want when we develop interventions. So with that, I'm going to turn it over to Shariva.
Hi. Hello, everyone. Thank you, Laura. And so, yeah, I think we learned about how users, putting the users at the center of an intervention can be really powerful. And so now we're going to take a deep dive into user-centered design. And when I myself took a deep dive into user-centered design, I found that there was a lot of literature, academic and non-academic, and some of it conflicted with each other. And so I kind of wanted to start at the beginning and I found myself with this book. It's from the 1970s and it's written by Don Norman and Stephen Draper. And they coined this term user centered system design. And so with that term, you can kind of see how the user centered design has its origins in human computer interaction or computer science. But since the 70s, since this book was written, this concept has really exploded and expanded to different disciplines, and there's also other terms. It has siblings now that wear different hats. So some of these terms are person-based approach, people-centered design, design thinking. And then this last one we all are kind of familiar with because being an MVR, especially and at Cornell, we have the human-centered design department. So um, so all of these terms that are on the board right now, they have nuanced differences from user-centered design, but the core values of putting the user at the center of this iterative design process are still the same throughout. So the basic steps of user-centered design are first you understand the context of use for the user, and this can be environmental, digital, social, and then you kind of start to you take that context and then you specify user requirements from that specific context, and then you design solutions, and then you evaluate those solutions against the requirements that you'd set earlier on. And you can see that this is kind of an iterative process with the dashed arrows on the screen. And so you understand, specify, design, and evaluate and over again until you reach a solution where everyone is happy. And even in so user-centered design is pretty broad, and applications can be field specific though. And in something like digital health intervention design, there are specific considerations that are unique to public health interventions that we might need to consider before we completely jump into a process like this. But when we started to design our e-heroes intervention, we found that there wasn't really a solid framework that existed to guide us through a process like this. So we began to develop our own. And so we went back to these basic steps and we took the basic steps and put them at the middle of this framework because we knew these were really, really important to us. And then we also anchored ourselves with the stages of intervention design. So we have planning and resources, intervention design, digital design, and implementation. And we're all pretty familiar with these steps, but the digital design is maybe the addition that is specific to designing a digital intervention. And what's important to note here is that the user-centered design principles in the center, they really do apply to each of these four stages, as I'll show you as we go through the model. So after we anchored ourselves with the stages, then we determined target actions that we needed to perform that were kind of like a measure of success for those stages. So for the planning and resources stage, at the end, we want to develop a strategic plan. And then for the intervention design stage, we want to assess user needs and map an intervention. And then the digital design stage at the end, we would want to design and pilot test this digital program or platform. And then for implementation, we're going to think about evaluating outcomes. So behavioral outcomes, implementation outcomes. And then this middle circle, the middle blue circle, is about digital considerations for each of the target actions. So as we're going to as we're going through the research activities to perform these target actions, there are unique considerations for digital health interventions. And so these are just some examples listed here. So for planning and resources, you need to think through your interdisciplinary team, community partners, funding, time, for intervention design. you consider target audience, but also the theoretical foundations and what are your outcomes? How are you going to measure them? And then for the digital design piece, what are your options for digital platforms? And then how can you kind of like understand those options with the target audience and the amount of digitization that you want? So we can think of a digital intervention as not fully digital. It can have some digital components, it can have some non-digital components. So that's just another consideration to think through. And then for implementation, things like efficacy, effectiveness, and fidelity and other implementation outcomes that we think about. So this is kind of our working model. It's still a work in progress, and so we would both really appreciate your feedback on this model as I kind of like go through and talk about how to use the model. But first, I want to call out this center circle, and this is about who the digital user is. So we generally know that the digital user, the primary user, is the participant or the target audience of the intervention or program. But the secondary user could also be the researcher or intervention designer, because the researcher is really the one that kind of takes the intervention and is sensitive to the type of data that's collected and how that data can be used to actually like measure whether or not the intervention was effective. And kind of like what Laura was talking about, in improving the optimization of the intervention. And then we have our tertiary users, which could be stakeholders that might be involved in dissemination or sustainability or other implementation factors of the intervention. So now I'll walk through how to look at each wedge of this model. So first we'll start off with the planning and resources. And the target action for this is to develop a strategic plan. And you'll see that I took these user-centered design principles in the center and brought them to the outside, because this is really what's going to anchor us through all of the considerations for this stage. And the way that you'll see this happen here is that there are questions for each of the stages of user-centered design that we can ask. But the point I'm trying to make is that we can't think through all of the considerations or all of the questions and make a comprehensive list of something that might apply to every single type of digital health intervention. So what's really important is that these considerations are anchored on the user-centered design principles, and that really serves as the guide to what kinds of questions you should be asking. So, for example, if we're starting with the planning and resources, do we have to understand the context of use? And questions we can ask are, who should be on the intervention development team? So what kinds of expertise do we need for this? And then who are also the potential users or stakeholders that we should involve with the intervention design? And then we can specify the user requirements by asking, what are the goals, vocabularies, metrics of success for the team members? And in this case, the users are the researchers or developers. And we can go through the rest of the principles and do a similar exercise. And then we can go to the next stage, which is intervention design. And the target goal here is to assess user needs and map the intervention. So to understand the context of use, now we think of our target audience or participants as users and try to understand what are their needs for using the intervention, what is their access. And then we specify the user requirements by asking questions like, how do they engage with technology? And like, what are their preferences? And again, we can go through the rest of the questions and also do that. Think about the theories and constructs and frameworks that might be applicable to these target audiences. And I'm not going to go through all of these right now for time's sake, but we can come back to these and talk about them, and we could also chat about them later. But what I will do is kind of talk about our research and how we used this model to make decisions throughout the process. So Laura talked about this first approach where the users were children and the developers or the partners were information designers. In the second approach, our users were adults, so they were parents, and we partnered with software developers. And the the kind of process I'm going to walk you through right now is the process for developing the eHeroes program, which is the digitization of the Heroes program. And so our target audience were parents of preschoolers, and these were Head Start parents, and they were mostly mothers or female caregivers that we were talking about. And it's because they were from Head Start, they were also primarily low income. So let's begin this process of walking through the model. The first stage was the planning and resources stage. So we wanted to understand or we wanted to develop a strategic plan. So we asked the questions of who are the people that are going to be on our team, and what is the type of expertise that we want, and we put together a team of public health researchers and interventionists, and also software developers and graphic designers. And then we proceeded to specify the user requirements. We quickly found out that we had different vocabularies and different metrics of success. And so we kind of created a language that we could all use and knew we were saying the same things, and create like a plan that we could move forward with that everyone was happy about. And then we moved on to the intervention design stage, where our target goal was to assess user needs and map the intervention. And here, first, we wanted to understand the context of use of our users. So to do this, we implemented a digital survey where we found that our target audience did mostly use smartphones to access the internet, and they also access the internet through or their connection was from a variety of different sources, like broadband, cellular network, even dial-up. And so these were considerations that we had to take into account when we wanted to build a digital intervention. And we also found out that they were actually interested in a digital intervention, or digital or hybrid intervention. So that was great too. Then we took what we found about the digital landscape and wanted to specify what their requirements would be. So we conducted some interviews where we found that time, relevance, and community were really the driving forces of their motivations and preferences for using digital interventions. So parents experienced a lack of time, and there was always a push and pull between what they wanted to do and the time that they had to do it. And so that made relevance even more important, because all the activities that they wanted to do, or would do, needed to be extremely relevant. And then there was also a sense of accomplishment from being a part of a community and supporting others, and there was motivation that also came from that. And then we also wanted to understand some more technical user requirements. So we found that parents often use their phones uninterrupted in the morning and at night, so before their kids woke up or after their kids went to bed. So that was really good to know. And then we also found that packaging information in 5 to 15 minute blocks was the ideal sweet spot for their information consumption. Then we set off to design our solution, which is the stage, or the part where we map the intervention, and we're actually currently doing that. So I can't really show you what we've done, but this process works iteratively with the digital design process, which is the next wedge of the app. So I'm actually going to move on to this process and talk more about that. So in the digital design process, our goal was to design and pilot test the digital product. And so I'm mostly going to focus on these three sections, or these three principles of UCD, and go through in more detail of how we approach this. So first, we specified our user requirements by defining certain constructs of user-centered quality assessment. So these were functionality, usability, and user experience. So functionality is the extent to which the product has the necessary features. So basically, like, does the product work? And then usability was the extent to which a product can be used by specified users to achieve specified goals, with effectiveness and efficiency. So this is a little bit more specific. And then the user experience, which is what Laura was talking about earlier, but it's the extent to which there's a positive and seamless experience while they interact with the app. So then we took these these specifications and we designed a solution to test it. So we designed wireframes, which are skeletons of a product. And in this case, we had no graphics in our wireframes. We had no color. Some of the buttons didn't work. But basically, wireframes are a super quick way to get feedback to get quick feedback and make quick changes and revisions. And so that's what we use to test our product. And we evaluated the wireframes against the 3 constructs of user-centered quality assessment in 3 different phases. So in the 3 phases had increasing levels of constructs tested and complexity. So we completed phase 1 and phase 2. And we're actually about to do the phase, or a few months out from doing the phase 3 prototype. But we're projecting to kind of have all of the bells, or most of the bells and whistles, to see if we can test that. But I'll go into a little bit more detail about what this actually means. So we'll take one of the constructs, for example, functionality. And in this case, we were testing the navigation, or our participants' ability to navigate through the app. And we found that there was a little problem with the back button. So in phase 1, this is what our on the phase 1 on the left, this is what our wireframe looked like, and our participants couldn't find the back button, and that was a huge problem because we wanted them to be able to go back and forth pretty easily. So in phase 2, we put the back button down here next to the continue, and that was super great for the users, and they were able to navigate through, and everyone is happy. So that's just one of an example of how we tested for and solved one of the functionality problems. This one's a little bit more complex, but more interesting. So this next construct is the usability construct. And here we were testing information structure, which is basically how people might be organize information in their heads. And so in phase 1, we kind of gave them like a staggered hierarchy of, first you pick whether you want healthy eating or being active, and then you get to pick a topic. And we found that our participants didn't really understand how the information was organized. So in phase 2, we put kind of everything on the table and created a dashboard. So here we had healthy eating and or physical activity, being active, and we had all the topics listed out. And so you could see what was contained in what. And our participants really liked this. They thought that it was really easy to understand, but they actually didn't use this dashboard in the way that we wanted them to. So in this case, there's this kind of like tension between researchers as users and participants as the users, where they liked it, but that we needed to go one step further because the researcher agenda was still not quite met. And so in this next phase, the prototype phase, which we haven't done yet, this is what we're proposing to test. It's a new type of dashboard that is that looks like the previous one, but hopefully will get us the type of interaction that we want. So this is a lot of words, but what you need to kind of pay attention to is the blue box. This blue box kind of shows how we went through and we tested a few different sub-constructs per phase, but then there were other ones that we added. So for the blue box, we have 2 that we are testing throughout, and then we also added a few new ones in phase 3, the usability evaluation measures and persuasiveness that we might test for phase 3. And then these get more complex as the phases go on. So this is kind of where we are right now. We're a few months out from testing the prototype. And so if you are interested in what the results of that might look like, yeah, feel free to reach out and we can chat about that. But some major takeaways from this portion of the from this portion was that we partnered with software developers instead of information designers. And as Laura alluded to earlier, the information designers really did a lot of the functionality and technical aspects of the work, whereas in this case, the software developers, they are really good at their jobs of coding and developing the app, but we did have to work a lot more with them about more of the technical aspects of like how do we want things to look and what kind of features do we want, what do we want the structure to look like. And then also with the users, with adults versus preschoolers, with preschoolers, we couldn't get too much information. But with adults, we can get a lot of information because adults have preferences and they voice them. And so, because we had more flexibility with the software developers, it was also great that we could get more information from our end users. So we could kind of like merge those two together to create something cool. But overall, we found that as we were doing this process, there was a gap in kind of trying to create a digital intervention using a user-centered design process for a health intervention, and there was no framework or guidance for doing this. And so our goal in creating this framework is that one, we use it as we go on to create our digital intervention, but also so that other researchers can use it to kind of systematically think through the considerations for building a digital intervention in a user-centered design approach. And with that, I will hand it back to Laura to quickly summarize.
So I'm going to just breeze through. I'm not even going to do this one because I want to make sure we have a couple minutes for questions. But just to kind of pull this all together, digital strategies can expand, they can reduce the burden and allow for personalization of behavioral interventions. We still need to use the behavior change techniques and translational research processes that we're all accustomed to using. But what it opens up the opportunity for is to use newer intervention designs that offer optimization and efficiency. So Kate Guastafaro was here in the fall and she talked about the MOST design. The SMART design is the sequential multiple assignment randomized trial, which it's very nuanced, but it allows for the personalization. And then JEDIs are just-in-time adaptive interventions. So you can look at who's responding and who's not responding and change the intervention strategies they might be getting. A lot easier to do with technology than it is to do in person. Just want to acknowledge the work that we've just presented is with a lot of folks, but want to just point out that from the BCTR that I'm fortunate to have the Evelyn Edwards Millman Fellowship, which allows us to fund Shariva for 2 years on a GRA. So the work that she just presented, which is part of her PhD, is funded by BCTR. So extremely proud of the work that she's doing and that she's able to share that with you today. If you're interested, you can do the QR code. The apps are free to download. So if you know any preschoolers and want to try them out, they're there. And then we have a few minutes for questions, I believe.
Gorgeous. So, are there any questions online to start? And no questions online. Awesome. Then folks in person. Yeah, Elliot.
Hi there. That was fun. That was great. I had a question about with the preschoolers, getting feedback from the preschoolers. Were you do you have a layer in the software maybe that tracks where they're touching and how long they're staying in different places, or do you maybe have video of while they're playing with the tablets?
Yeah, great question. So budget constraints did not allow us to build the back end of those initial apps. At first, we were like, oh, we'll get how many downloads and how long do they stay on it? And the informational designers were like, that's going to cost you X amount. So where do you want to put your resources? With our new software developers, they're like, the back end's the easy part. But, and I'm like, really? But what are we going to get on the back end? So we have to be thoughtful of how much data we're going to get. So instead, what we have video. So when we pilot tested, we videoed the kids of how they were interacting with it just to see. A lot of what you get from working with preschoolers is emotions. Are they like fun? Really is probably our main metric. When it was time to take them back to the classroom, were they eager to go back or did they want to stay? So not as much as the quantitative measures that we're used to, but really more the emotional and the qualitative measures that we got from them. Yeah.
Any other questions? We'll come over here and then come back.
Yeah, thanks. That was great. I have a question. I don't know if if it's answerable or fair in this context, but we're part of a center that looks at non-pharmacological approaches to pain in older people, and often there are app-related projects that people have done or that we're aware of. And to me, the development in some ways seems to be the easy part, because in this Darwinian struggle for attention for an app with so many, most of the interventions, to be honest, really disappear without a trace. Like there's no ability to promote them. Most projects don't offer ongoing technical assistance. There's no place where you can actually go for help, and people have moved on to the next project. They've gotten a new grant. So I'm curious with this, for example, have you solved problems of uptake, of marketing, of ensuring that people, so we're just noting again and again that these projects are well funded, they do well, but then there's no attempt to expand their reach and their uptake because people have moved on to something else, or because there's so much competition with other apps.
Yeah, I think that's true to whether it's a digital or just a traditional intervention, right? We move on to the next project. We don't get funding for sustainability, scalability. What I will say is the positive of working with New Mexico State is they're housing it, right? So while I presented it maybe as the negative of the IP and the copyright issues, they've taken it on as part of their and they're maintaining the app and the software updates, and they're pushing it on their website. There's this whole website has everything on it. So that's the beauty of extension, right? And so that they're tied to extension dollars, which promotes that. That's going to be the problem for us on the second approach that Shariva talked about. That app, once their software developer is done in November, they're like, good luck with that. And I'm like, oh crap, right? So it's going to be that push-pull of we develop great things. I think, philosophically, I don't want anything sitting on a shelf, but we've got to figure out how to do that. So your question's bigger than, and I think it's one we consistently struggle with as intervention folks.
Thank you so much. So we're unfortunately out of time. But if you have any other questions, I encourage you to stay back for a couple minutes and talk to our lovely presenters. Can we give them another round of applause?